Pinpointing the Benefits of Acupuncture in Oral Health, presented by Melanie Mansfield, Carla Sutherland, Jade Weil, Karen Jaffer, and Hillary Cody. By the end of this presentation, we will be able to define acupuncture, determine the correlation of acupuncture to dentistry, and identify the benefits of acupuncture in treating temporomandibular disorders, anxiety, gag reflex, and xerostomia. There are a few different acupuncture methods that are currently available, including acupressure, electroacupuncture, dry needling, and traditional acupuncture. However, we have chose to focus on traditional acupuncture and how it releases the body's natural painkillers, anti-inflammatory substances, and symptomatic pain relief associated with patient discomfort. Acupuncture is a form of traditional Chinese medicine that has been used for thousands of years. It's the insertion of thin, tiny needles into specific points of the body. It's done by hand stimulation and stimulates the nerves, connective tissues, muscles, and the body's natural painkillers that were mentioned previously, called endorphins. Traditional acupuncture is used to treat pain, stress, anxiety, gag reflex, and promotes overall wellness in various ways. A professional who is trained in the technique of acupuncture would be able to offer it, such as dentists, chiropractors, acupuncturists, physiotherapists, naturopathic doctors, massage therapists, and medical doctors. We have touched on what acupuncture is and who can offer it. Now, let's talk about what acupuncture may be used for.
The first topic we are going to discuss today is temporomandibular disorder, or TMD. We are going to explore the research and discuss the possible benefits and implications regarding the use of acupuncture as a treatment option for TMD. The prevalence of TMD is between 5 and 12%, based on the National Institute of Dental and Craniofacial Research. They also state that this percentage is unusual for chronic pain conditions. TMD is more common in women and younger people due to the fluctuating hormones. We found a meta-analysis on the Clinical Journal of Pain by Wolters Kluwer comparing the effects of acupuncture to sham acupuncture or control groups. The meta-analysis showed positive results, but the main conclusion was that the methodologic quality of the studies analyzed requires more evidence. Only 9 randomized controlled trials fulfilled the inclusion criteria and were included in this analysis. The analysis states that overall acupuncture is more effective than placebo at reducing the intensity of pain. 5 of the studies were acceptable, except that the sample sizes were very small. To reproduce this research in future RCTs, it would be beneficial to use larger sample sizes. In conclusion, the results show that acupuncture has a statistically significant short-term analgesic effect on TMD. Additionally, evidence-based dentistry also posted a meta-analysis and reviewed 5 RCTs that were at low risk of bias. They concluded that there is limited evidence that acupuncture is more effective than sham for alleviating pain and masseter muscle tenderness in TMD. Therefore, in general, there is limited research done in this area, and it requires larger studies to get a confirmed effect of acupuncture on pain relief for TMD. This image is from the School of Natural Healing website, and it depicts 3 of the most common acupoints used for the relief of TMJ pain. They target the muscles involved in mastication in TMJ pain. The first is SI-19, which is located anterior to the tragus and posterior to the condylar process, into the depression formed when the mouth is open. Second is GB12, which is located in the depression posterior and inferior to the mastoid process. And lastly is ST6, which is located one finger width anterior and superior to the angle of the mandible at the belly of the masseter muscle.
Next, we'll discuss how patients with anxiety can benefit from acupuncture. As we all know, dental anxiety is highly prevalent amongst our patients. It's reported to range between 40 to 60% in Western countries. Therefore, auricular acupuncture can be a less invasive treatment for acute anxiety. The mechanism behind treating anxiety with ear acupuncture releases endorphins, which are neurotransmitters that have painkiller effects on our bodies, allowing the body to feel more relaxed and with a better outlook to cope with everyday tasks. A randomized controlled trial published in 2012 conducted a patient-blinded study that compared anxiety before dental treatment following auricular acupuncture at the relaxation, tranquilizer, and master cerebral points versus acupuncture at sham points in a non-intervention group. Anxiety was assessed using the Spielberger State Trait Anxiety Inventory, which is a validated questionnaire that measures state anxiety. They measured anxiety before auricular acupuncture and 20 minutes thereafter, immediately before dental treatment. The study concluded that acupuncture reduced state anxiety more effectively than the sham and non-intervention groups. In contrast, there is a lack of direct comparison of acupuncture to proven standard drug treatments. Therefore, more research is required, and the present results need to be tested in larger randomized control trials. These are the points targeted for anxiety. The finger, shoulder, and tonsil points represent the sham group, which has no documented effect on anxiety. The relaxation, tranquilizer, and master cerebral points represent the auricular acupuncture group, which has demonstrated anxiety-reducing effects. The function of the relaxation point is specifically used to treat anxiety and stress-related conditions. This tranquilizer point produces a general sedation effect, facilitating overall relaxation and relieving generalized anxiety. It also reduces high blood pressure and chronic stress. The master cerebral point represents the prefrontal lobe of the brain, the part of the cerebral cortex which makes decisions and initiates conscious action. Stimulation of this auricular point diminishes nervous anxiety, fear, worry, and lassitude. Through our research, we discovered that the common location for treating TMD, anxiety, gag reflex, and xerostomia with acupuncture lie around the external ear, making it easily accessible for the oral practitioner. This is beneficial because the needles are in a location that do not interfere with access to the mouth for dental treatment. Also, if the patients have a needle phobia, they are out of the patient's line of view.
Next, we're going to discuss how acupuncture can help reduce overactive gag reflex. Gag reflex can be induced by somatic triggers such as touching the lateral borders of the tongue or palate, or by psychogenic triggers, where just the thought of a stimulus is enough to cause a reaction. We see issues with gag reflex when mirrors or section touch trigger areas, and with things like taking impressions or isolating with rubber dams. It is thought that both of these factors can contribute to the response. For example, somatic gagging induced by a dental mirror placed in the mouth should also occur with other objects. However, many people who gag at the dentist can eat and brush their teeth with little or no reaction. One of the anti-gagging points targeted is on the ear, as shown in this figure. The needle is inserted into the anti-gagging point and left in place during dental treatment. In one study of 10 participants, ear acupuncture completely controlled the gag reflex in 8 cases and partially controlled the reflex in 2 cases. Dental treatment could be carried out in all cases and at all visits. Additional clinical time was only about 2 to 3 minutes, and the conclusion of the study was that ear acupuncture was successful in controlling the gag reflex. They also noted that it was a safe, quick, and inexpensive, relatively non-invasive technique. They did note, however, that a controlled clinical trial was required to investigate the placebo effect. Also, we noted that it is quite a small sample size to be able to make a definitive conclusion. Another point targeted is point P6 in the wrist. This is located between the flexor carpi radialis and the palmaris longus tendons, located approximately 3 finger widths from the wrist. There was a study including 33 participants with previous nausea during dental procedures which hindered or prevented dental treatment. The study compared acupuncture P6 point versus non-penetrating sham acupuncture, followed by taking impressions of the maxillary arch. The authors concluded that the study demonstrated that acupuncture point P6 was effective in controlling nausea in the maxillary impression taking. However, a Cochrane Library review of the same study found that evidence was of low quality and the results did not allow a robust conclusion regarding the effect of acupuncture at P6 for gag reflex.
The final topic that we pinpointed in our research is xerostomia. First, we would like to acknowledge that in the two studies we will be discussing, they refer to the term xerostomia. We know this is often used as an umbrella term for signs and symptoms, but specifically, this is referencing the reduction of salivary flow, otherwise known as hyposalivation, and the use of pilocarpine or traditional acupuncture for salivary flow. An overarching theme that we saw in our research was traditional acupuncture as an alternative over pilocarpine. Pilocarpine is a medication to treat xerostomia by stimulating an increase in saliva with functioning parotid glands. However, its success is limited because of potential side effects, which include sweating, nausea, and chills. Therefore, traditional acupuncture may be an alternative without potential side effects. The first study we researched was a randomized controlled trial of acupuncture for prevention of radiation-induced xerostomia among patients with nasopharyngeal carcinoma. 40 patients were randomized to acupuncture treatment and 46 to standard care. Patients had to have nasopharyngeal carcinoma and no history with xerostomia. Patients were treated 3 times a week on the same days they received radiotherapy and following 6 months after the end of radiotherapy. The results showed treatment with acupuncture statistically significant lower xerostomia score in week 3 to week 11, but both group salivary score were the same at 6 months. The second study we reviewed showed conflicting results with the previous study in regards to prevention of radiation-induced xerostomia. This second study was a systemic review of the effects of acupuncture on xerostomia and hyposalivation. They chose 10 randomized controlled trial studies. They reviewed them and investigated their effect of acupuncture. Included was the first study. What was concluded is there is some evidence that acupuncture can increase salivary flow rate and or alleviate dry mouth symptoms in patients following radiotherapy. Results need to be interpreted with caution because of the high risk of bias in the 10 randomized controlled trials. Further, well-designed, double-blinded trials with sufficient number of participants are required to determine the potential benefit of acupuncture. These two images provide a visualization from the first study we researched for xerostomia, which was a randomized controlled trial of acupuncture for prevention of radiation-induced xerostomia among patients with nasopharyngeal carcinoma. We have highlighted in yellow where traditional acupuncture was pinpointed in this study. KD6 was pinpointed above the ankle. RN24 was pinpointed submental. Point 0 and Shenman were both pinpointed in the ear.
We have come across some research that suggests relief benefits in treating trigeminal neuralgia, headache and migraine relief, and neck pain. However, we have decided to put a pin in these topics, but felt that they were worth mentioning, considering headache and migraine relief is one of the main reasons a person seeks out acupuncture for their head and neck.
Some contraindications to keep in mind that were mentioned on the Mayo Clinic website are Bleeding disorders or the use of blood thinners due to the increased risk of bleeding or bruising. Pregnancy due to the thought of potential disruption of the meridians, which is thought to stimulate labor. And lastly is pacemakers, due to the potential that electrical stimulations may interfere with the functioning of a pacemaker.
Why is acupuncture important for oral health professionals? Acupuncture can be used to manage a wide range of disorders in dentistry, and it may provide new hope for patients with disorders that cannot be managed with conventional treatment modalities. It also provides us with an opportunity to connect with other medical professionals to ensure that our patients are receiving the best evidence-based care.
We also looked into the qualifications required to practice acupuncture. Locally, the Canadian College of Acupuncture and Traditional Chinese Medicine offers a 2 to 3 year diploma program. There are similar programs across Canada. We also saw that in the United States, UCLA School of Dentistry offers a program called Acupuncture and Integrative Medicine. This is specifically aimed at dentists, and it is completed over an 80-hour 4-session course. We contacted UCLA about this program, and they said that although the program has been popular, so far only American dentists have completed it. Currently, acupuncture is not part of the scope of practice for any dental hygienists in Canada. We also looked into whether dentists could administer acupuncture in Canada with a focus on the Atlantic provinces. It was not clearly laid out in a lot of the provincial dental scopes whether or not acupuncture could be practiced in the dental setting. So we reached out to all of the provincial and territorial colleges to verify, but are still awaiting many of the results. In Nova Scotia, however, the executive director of the Nova Scotia Dental Association let us know that the Provincial Dental Board of Nova Scotia determined that providing the licensee has proper training and is operating within scope, the practice of acupuncture is permissible. So it seems that although not explicitly stated, this may be an acceptable practice in other provinces and territories as well. Similarly, in Newfoundland and Labrador and Prince Edward Island, acupuncture may be part of the DDS scope of practice with proper training, and the practitioner must demonstrate validity in training and application. We also know that dentists are able to practice acupuncture in Alberta. We contacted a dentist who currently uses acupuncture in their practice. She had training through a program at the University of Alberta that is no longer offered. The dentist indicated that she uses acupuncture in conjunction with dentistry for pain management, anxiety during a procedure, and sometimes for TMD, and that many people request acupuncture as a more conservative option for anxiety management. Furthermore, the registrar of the CDHMS indicated that although acupuncture is not currently within the dental hygiene scope of practice, it is possible that based on scientific evidence, it could be included in the DH scope of practice in the future.
In conclusion, based on our research, acupuncture appears to have some beneficial effects on pain and anxiety that could be applied within the oral health environment. So, to pinpoint the facts as dental hygienists, it is currently not within our scope of practice to perform acupuncture.
Any questions? We thank you for taking the time to listen to our presentation on pinpointing the benefits of acupuncture in oral health.